I belong with the misfits.
Okay, will everybody please take their seats? Shh. We want to leave at 9, I think. If everybody could go to their seats, that would be wonderful. That's it. All right, well, good evening, everyone, and thank you for joining us. It's absolutely wonderful to see you all this evening and in person. My name is Kevin Rigby, and I'm so honored to once again be the master of ceremony for what I call the most special event that takes place each and every year. This is going to be the Alliance for Aging Research Heroes in Health, an evening to celebrate generativity, joy, and healthy aging. Now, tonight indeed is going to be very special. And why do I say that? A few reasons, and I'm going to appreciate your flexibility. We have some incredible heroes, really heroes that we're going to honor up here, which I know has always made a big portion of the meeting so important here for this. But this is the 30th year for the Dinner for the Alliance for Aging Research. And what better place to celebrate that special and impressive accomplishment but the iconic Waldorf Astoria. So welcome here. So I know you're all going to bear with me because right now we have Congress is in session, so we're trying to move some of the speakers in and out, and so I know you'll be patient with us. But we thought tonight, if we could, we're going to start off with a little bit of fun. So I want everybody to pay attention because there's prizes at the end, all right? This is going to be a trivia, and I'm going to explain the rules to you. This won't be as hard as the SATs, so here we go. Throughout the evening, I'm going to ask you 4 multiple choice questions, right? There's going to be 4 multiple choice questions throughout the evening. As a table, you will be answering those questions. On your table should be 3 iPads. Does everybody see the 3 iPads? All right. You're going to have 30 seconds. Shh. You have 30 seconds to answer on your iPads. You have to reach an agreement. All 3 iPads have to be hit with the answer. So if this table says it's A, all 3 of you have to submit A to get a vote in. All right? The winner is going to be based on the number of right questions as well as the speed of which you answer it. All right? Now, does everybody understand that? No. All right? Again, I'll go through those rules. On your table, you have 3 iPads. There'll be 4 questions coming at you. If you can, each of you have to vote the same way, all 3 iPads. The winner is going to be based upon right answers and speed. So let's do the first one, okay? At the Waldorf Astoria, it's synonymous with luxury. Did you know that the Waldorf Astoria is responsible for creating some of the most timeless dinner recipes or recipes ever made? So here's our first question. You ready? Which of the following classics were not created? Number 1, red velvet cupcakes. Oysters Rockefeller. Eggs Benedict. Or Thousand Island dressing. It's your time to vote. Again, which one was not created at the Waldorf Astoria? Done? Okay. All right. I see we have a winner. The correct answer was B. B, Oysters Rockefeller. Now, that dish was created by Antoine's restaurant in New Orleans. All right, so that was question 1. We have 3 more, so don't give up. You can keep trying, okay? All right, let's get down to business. We want to say sincerely, that having you here means the world to the Alliance for Aging Research. We absolutely understand how many events you have to go to, and you're stretched so hard and what you can support. Seeing you here tonight, having the record number of people in this room tells us something, that the mission of the Alliance is truly making a difference. As you know, that we understand that what the goal is really to accelerate health, to accelerate scientific discoveries, making sure that they improve the universal experience of aging. We know that what the Alliance does is a culture that respects aging as a greater good and values investments that advance independence, dignity, and equity. And that's what we're supporting tonight. So if you turn your attention to the screen behind me, you'll see a short but powerful sizzle reel of the work done this past year by the Alliance. That's great. Wasn't that impressive? Now it is truly my pleasure to bring up to the podium our inspirational leader, the President and CEO of the Alliance for Aging Research, Sue Peshin.
I was told to wait 5 seconds. Okay. In 1979, my grandparents, Sylvia and Ben Melnick, took me to see the Broadway tour of The Man of La Mancha at the Stanley Theater in Pittsburgh. That's the record cover that I used to listen to The Impossible Dream over and over. The music was inspired by the 17th century novel Don Quixote by Miguel de Cervantes, which is considered one of the greatest works ever written. I read it in high school and I loved it. The plot revolves around a poor man from La Mancha, Spain, who reads so many romances that he loses his mind and decides to become a medieval knight to revive chivalry and serve his nation under the name Don Quixote de la Mancha. The phrase that we've all heard, tilting at windmills, originates from an episode in the book where Don Quixote perceives the windmills in front of him to be giants, which he tilts at or attacks. The word quixotic is also from the book, and it's generally used in the context of impracticality or idealism. The first theme that we picked for tonight's celebration is integrity, which is a pretty lofty one. It's also one of the Alliance's core values, and to us it means upholding high moral and ethical standards in everything we do at the Alliance and in our partnerships. When I look back on the past year, I think integrity for us was about choosing to work on both realistic and reachable, as well as maybe slightly quixotic goals in our health education, advocacy, and policy issues, because we saw them as reflections of our integrity, and they were simply the right things for us to do. Here's a bit of the mix. We co-convened with the American Society of Consultant Pharmacists and folks across long-term care, the vaccine community, the FDA, CDC, CMS, HHS, and even the White House to discuss lessons learned from COVID-19 and to call for expanded access to all CDC-recommended vaccines in long-term care. We created our Best Shot educational resources seen by tens of millions aimed at persuading everyone to get back to routine vaccinations missed during the pandemic. We encouraged older adults to learn about RSV. We debunked more of the stream of disinformation on COVID, and we shared an updated schedule of CDC-recommended vaccines. We also worked with our co-conveners, the National Caucus and Center on Black Aging and Healthy Women, and the more than 255 partners in the COVID-19 Vaccine Education and Equity Project to advocate for FDA CDC alignment on simple recommendations for equitable access to the new COVID vaccines for this fall, which went through, and which all of you should go get, along with your flu shots and RSV if you're over 60. And I just want to say ASCP is a table 10 and they may have shots. No. This past February, we observed the 7th anniversary of Heart Valve Disease Awareness Day that takes place every year on February 22nd. In 2023, the Alliance partnered globally with 121 organizations, hosted our flagship with the National Caucus and Center on Black Aging and MedStar Heart and Vascular Institute on a screening event at one of NCBA's independent living communities in Northwest, held an event with Congressman Andy Barr at CHI St. Joseph Hospital in Lexington, Kentucky, that was featured on Good Morning America, and activated more than 1.2 million people to spread life-saving messages about heart valve disease risk factors, symptoms, and the importance of early detection and intervention. We turned our Shake the Stigma of Neuropsychiatric Symptoms video into TV PSAs, and we released expert conversations to help those living with Alzheimer's disease create a care plan and get the support they deserve. Tonight, we have 3 of our stars from those videos here. Terry Montgomery and her daughter, Sean Lowe, and Alliance board member, Jay Reinstein. Raise your hands, guys. Woo! We continued our work on the Project Pause Coalition, which we co-convened with ASCP, because we like hanging out with them, that seeks to ensure patient-centered, appropriate care without stigma or barriers for people with neuropsychiatric symptoms of dementia who live in long-term care settings. This year, we secured FY 2024 appropriations language asking the FDA to review its boxed warning for antipsychotic use in people living with dementia. in order to help provide a clearer clinical path forward for new on-label use medications that are in the process of being developed. We continue to empower older adults to take charge of their health on issues of safely managing pain, dealing with vision loss, managing ASCVD risk factors, and preserving muscle function, all of which can challenge older adults and providers and require complex conversations which don't often fit into today's retail healthcare. And then there's our formidable associates at the Institute for Clinical and Economic Review, or ICER, and at CMS. I know we may seem like we always have an issue with one or both of them. And yeah, there have been a few here and there this past year. However, issues of access and equity are at the core of our mission, and we can't be silent. No matter who is in charge, even at the highest levels, we're consistent in our nonpartisanship. But we also do tout the work of CMS and the Medicare program when they do right by beneficiaries. A good friend of mine told me about the Hidden Brain Project, which I recommend. The most recent episode features Elliot Aronson, who is a social American psychologist that spent his career studying cognitive dissonance. Dr. Aronson says we're now living in a time of cognitive dissonance, where we often have to convince ourselves that we're doing the right thing to deal with the mental discomfort that occurs with conflicting thoughts, information, or behaviors. The stories we tell ourselves reduces our discomfort, restores our sense of balance, and eliminates the dissonance. Several of the issues we've chosen to work on challenge us with social cognitive dissonance. It's really tough to create policy that allows for appropriate use of antipsychotics, and it's much easier to demonize what happens in nursing homes and double down on punitive measures that end up restricting access. One of the main ways to get over cognitive dissonance, according to Aronson, is by facing the truth and going out on a limb with other people. And that's why we chose collaboration for our second theme. If the Alliance were to describe our superpower, it would be collaboration. Collaboration makes it a lot less scary to stand for hard things and resist the temptation to diverge. It provides a code of conduct for us to stick with each other. We all need at least one person in our lives who interrupts the dissonant narratives in our brain, who will both support us and tell us when we're being an idiot. Sometimes we need more than one person. Even when, and especially when, you don't want to hear it, and even if you don't listen all the time. We also need people around us who help us grow. Nothing we do at the Alliance is just done by one person alone, and in fact, our strength comes from being dependent on each other in pursuit of our common goals. And these include our Alliance board members, our supporters, and our many advocacy partners. As the African proverb says, if you want to go fast, go alone, and if you want to go far, go with others. On that note, I have an important list of thank yous. So I appreciate you joining me in acknowledging everyone. First, I want to thank our host with the most, Kevin Rigby. You have an awesome, wonderful, uplifting energy, and we look forward to sharing the stage with you every single year. Thank you to Jim Scott, who chairs our board of directors, and to Michelle Marcus, who serves as vice chair of our board, for serving as our Heroes in Health 30th Anniversary Celebration co-chairs. We sincerely appreciate all of your hard work and input in helping us shape this year's event and for introducing us to new friends who are joining us for the first time. Our entire board of directors supports us and our mission in countless ways and serves as our guiding light. In addition to Jim Scott and Michelle Marcus, we're fortunate to have several board members here with us tonight, and I'm going to ask those in the room to please stand and ask all of you to join me in acknowledging them. So what can I say? We are grateful and proud to partner with all of you in the public and private sectors of healthcare and healthy aging. We are leaning in to appreciating that support because it takes a village to make positive change. This evening would simply not be possible without the kind support of our sponsors. Please join me in applauding them at the end. Our award underwriters include the Claude Pepper Foundation, sponsor of the Claude Pepper Award for Advancing Healthy Aging, Eli Lilly and Company, sponsor of the Distinguished Public Service Award, Advanced Medical Technology Association, or AdvaMed, supporter of the Silver Innovator Award, and Johnson & Johnson, supporter of our Perennial Hero Award. Our 30th anniversary sponsor, GlaxoSmithKline. Our silver sponsors include AbbVie, Acadia, Astellas, Better Medicare Alliance, Biogen, BMS, and Gilead. Our bronze level sponsors are Healthy Women, Lundbeck, Neurocrine, Novavax, Penn Quarter Partners, PWR, Prevent Blindness, United Health Group, and USP. Additionally, we thank our fabulous conversation sponsors, Abbott, Eisai, Merck, and Otsuka. Our conversation supporters, Applied Policy, Ardelyx, Bright Focus Foundation, and Pharma, and our conversation innovators, Alzion, Bio, Chippa, Dexcom, Exelixis, Global CEO Initiative on Alzheimer's Disease, King & Spalding, Mikulski Health Force, Pfizer, PCMA, Venable, and Women Heart. Let's give all of our sponsors a round of applause. And last, I am so proud of the 11 individuals I get to work with every day that tackle all of these issues. They are super smart, motivated, and kind, a true team of people that are essential to each other's success and to mine. All of what I just shared is from them and due to them. I also want to call out Sarah Delgado, who many of you know. Sarah, I hope she's in the room at this point. She's here. Yay. Okay. She's the ringleader behind everything you see, eat, and experience tonight. And I'd like Sarah and our entire team to please stand and for you to please join me in acknowledging them. Our final theme of the evening for us is always healthy aging. The social narrative on aging today is often a contradiction between 80 is the new 60 and ageist protests to end the so-called gerontocracy running the country. At the same time, we haven't quite been willing or able as a society to recognize how structural racism and other negative social determinants accelerate aging and the onset of chronic diseases that accompany it. Clinical care is more rushed for both clinicians and their patients, and cost effectiveness rules above all. We have to do more together on all of these things if we want to make healthy aging possible and accessible for everyone. So how do we win at healthy aging? One way Don Quixote teaches is being able to laugh with your chosen crew at one's hardships and at oneself, especially the more ridiculous the problems that are in front of us. It's pretty much why I have upped my meme and GIF game. And yeah, the next slide would be good now. I just gave them the stuff at the last minute. There we go. And it gets me through, and hopefully it helps others as well. With so much unknown as we all age and cognitive dissonance facing us at every turn, humor helps steady us when we're up on a metaphorical tightrope or two. I'm supposed to tell you before I go, if you take pictures, they don't count without tagging us and using our hashtag HeroesInHealth. We will like them, and we will keep the party going. And on behalf of the Alliance for Aging Research and myself personally, thanks to all of you for being here. We are honored to have you join us for our 30th anniversary celebration, and I hope you enjoy the rest of tonight's program. Thank you, thank you.
It was planned. I did that on purpose. Oh. Some of you remember Chevy Chase, but I won't talk about that. It may be my age. I'm better now. Thanks for asking. Now it's my honor to introduce our first presenter, T.C. Roberge, who serves as the head of federal government affairs for Eli Lilly and Company. T.C. developed his interest in policy and politics while attending Georgetown University and Georgetown Law School. As a recovering tax lawyer, he began his career in politics, serving as the legislative counsel to then United States Senator Peter Fitzgerald from Illinois. He subsequently joined the team at the American Medical Association, where he served as the senior lobbyist for almost 15 years. Lilly generously supporting this year's Distinguished Public Service Award. Please join me in welcoming TC to the stage.
Good evening, everyone. I'm happy to be here tonight on behalf of Eli Lilly to present the 2023 Alliance for Aging Research Distinguished Public Service Award, given each year to a Republican member of Congress who is leading the way on policies encouraging medical research, innovation, and care to benefit all Americans as they age. This year's recipient of the Distinguished Public Service Award is Congressman Brad Wenstrup. Congressman Wenstrup was first elected to Congress in 2012 to represent the people of Ohio's 2nd Congressional District in the U.S. House of Representatives. As he stepped into the halls of Congress, the congressman already had a remarkable record of service, holding titles such as physician, Army Reserve officer, Iraq War veteran, and small business owner. It is with the knowledge gained from these foundational experiences that the Congressman works to tackle the many challenges facing our country today. In the 118th Congress, Congressman Wenstrup serves on the House Committee on Ways and Means and its Health Subcommittee. He has sponsored multiple bills to expand and protect patient access to medical treatment, including H.R. 4818, the Treat and Reduce Obesity Act of 2023, which will permit Medicare coverage for medications that help treat individuals with obesity, and H.R. 2630, the Safe Step Act, which will protect patients by placing guardrails to prevent medically inappropriate uses of step therapy. Additionally, the Congressman is a leading voice on the Hill for protecting the centrality of the physician-patient relationship and has championed efforts to prevent discrimination in coverage and reimbursement policy. Congressman Wenstrup, everyone in this room appreciates and honors your military service, and we applaud the leadership you have demonstrated during your time as an elected official. Today, it is our honor and privilege to present you with the 2023 Distinguished Public Service Award. Please join me in welcoming Congressman Wenstrup to the stage.
Well, thank you very much, TC, and it's a pleasure to be with all of you here tonight. You know, being in Congress isn't something I set out to do in my life, but sometimes you never know where you're going to end up. But I want to thank all of you for being here tonight and for the work that you do all along. I want to thank your leadership teams, and I thank Lilly, and just really the whole Alliance for the work that you do. When I started in practice in 1986, it was just me and 2 employees, and if someone was sick, my mom came in, an old LPN that was willing to help out. That's how I practiced. I later joined a large orthopedic group. My specialty was foot and ankle. I took care of a lot of geriatric patients, But also we everything from peds to geriatric, sports, and orthopedic surgery, of course. So it was a good background. Before I came to Congress, I was serving as a residency director, and I served on our Board of Health in Cincinnati, Ohio. And I think that's what our founders had in mind, was for people to go out and experience real life and then bring those situations, those experiences that you have to Congress, whether you're a farmer, a plumber, a doctor, whatever the case may be. All of these things are needed here in Washington. But I decided to come to Congress because I thought maybe it's an opportunity to help more people. I had the experience of deploying to Iraq. I was chief of surgery of a combat support hospital stationed at Abu Ghraib prison. We were there after the scandal, and our mission was not only to take care of our troops, but to take care of the enemy. And, you know, as physicians, that's what you do. And let everything else take care of itself. We just took care of people. That's what we as physicians want to do. And it's often difficult today. So I sit on Ways and Means Committee. I'm also chairing the select subcommittee on the coronavirus pandemic, and that involves everything that we did. It's an after-action review, lessons learned. What did we do right? What did we do wrong? And a lot of things were wrong. If you look what happened in the nursing homes in New York, a lot of things were done wrong. We can't let that happen again. We can't let that happen again, and we've got to take care of everyone, including our elderly. I can tell you with our Doctors Caucus and with the doctors that are in Congress, you know, in America and around the world, we also often talk about your lifespan. Your lifespan is one thing, but what about your health span? How do we keep people healthier longer? You know, TC mentioned the bills that I support, like the treatment for obesity. There are so many things that we can prevent and make better and allow people to, even with chronic diseases, go ahead and live a more normal life, to be part of society, to have a job. What can we do to prevent things? Just keep people healthier. One of the problems that I see here, and I brought this up in Ways and Means Committee, when we talk about this is going to cost this and this is going to cost that, what value do you put on the healthy human life? There's a lot of value there, but it's hard to measure by Congressional Budget Office, but we got to start thinking that way and think about that more and more. I mentioned the Safe Step Act. We want doctors to be able to prescribe for their patients what they feel their patient needs without delay, instead of someone who's never seen the patient telling you what you have to prescribe or what tests you can order. That's a problem. Doctors are being taken out of the equation. They're being told what to do every step of the way. You know your patients when you're a doctor. You know your patients. You know what's best for them. Your reputation and your living depends on doing the right thing. Why do we have to have someone in Washington or in an insurance company or somewhere else tell you how to do it? That's a problem we have. But we're going to continue fighting, because that's on behalf of patients. The other bill we have is protecting health care for all. No discrimination based on your underlying morbidities or coexisting conditions. No more discrimination on that. We can't have that. We're going to treat everyone as best we possibly can and make good decisions. My goal as we go forward is to be the healthiest nation on the planet. How do we do that? Too often when you hear health care in Washington, people start talking about Medicare, Medicaid, the Affordable Care Act, all that. How about we put as our goal, and what success would look like is to be the healthiest nation on the planet, and how do we go about doing that? And that's to make sure that there's access to care, that there's new innovations, that there's new treatments, and we don't get in the way of those types of things. It's extremely valuable. And thank you. Thank you for all that you are doing, really on behalf of some of the most vulnerable as we get older. I've got gray hair. I'm 65. I'm right there, right? But I do say, you know, my dad passed away 3 years ago at 87. My mom is 91, still living in the house that I grew up in, and still driving. So I appreciate all you're doing, because we should be focusing very often on the ones that focused on us throughout our lives. It seems like a good idea to me. Thank you all very much. Appreciate the word. Thank you.
Well, congratulations again, Congressman. Well deserved. Just for the record, those steps on the right side are much easier than over here. I measured them. It's like this, number one. And two, there was no need for the congressman to talk about hair. That's not right. I have an HR room for a few of you. All right, that being said, let's do another quiz. Some of you did well. Again, get your pads. All right? All right, I know, I can feel the excitement. All right, here's the question. Shh. What term did the Alliance founder, Dan Perry, my friend, coin for the rising adult population? A, silver sprinkle, B, silver shockwave, C, silver tsunami, or D, silver squall? You have 30 seconds to answer. Make sure all of you answer on the 3 pads. Begin. Five, 4, 3, 2, 1. Voting's over. All right. The answer is silver tsunami. All right. Oysters, silver tsunami, we're doing good. In the back is doing great. All right. So the next one, I'd like to introduce our next impressive presenter. It is my privilege, really, to introduce Kim Zimmerman. Kim serves as the Senior Vice President, Head of Federal Government Affairs for AdvaMed, a division within the Advanced Medical Technology Association, which most of us commonly known as AdvaMed. Prior to joining AdvaMed, Kim honed her experience in federal government affairs as Vice President of the American Healthcare Association, heading up the group's Congressional Democratic lobbying team, and leading development of the strategies for outreach and engagement. She also was the director of the One Campaign, WellPoint, and Cephalon. The Alliance is grateful to AdvaMed for its generous support of the Silver Innovative Award. Let's give her a big round of applause, welcoming Kim. All right.
Great. Good evening, and thank you, Kevin. The Silver Innovator Award recognizes an outstanding individual who has furthered research and innovation in healthy aging. For 62 years and counting, 62 years and counting, Dr. Henry Buchwald has been revered as a doctor, surgeon, teacher, healthcare pioneer, and patient advocate at the University of Minnesota Medical School. Dr. Buchwald holds 20 device patents, including the first implantable infusion pump used in insulin delivery and continuous chemotherapy delivery. Dr. Buchwald's illustrious career started in New York at Columbia University, where he received his medical degree. After serving our nation as a captain and chief base flight surgeon in the Air Force, he completed his medical residency at the University of Minnesota. As a faculty member and researcher, Dr. Buchwald devoted much of his career arguing against the social stigma of obesity, convincing the medical profession and the public that surgery is an integral approach to the disease. His novel paper in the publication Circulation led to the $60 million NIH-funded 17-year program on the surgical control of hyperlipidemias. It was the first customized, randomized clinical trial to demonstrate that lowering cholesterol through his partial ileal bypass, or PIB operation, which was later named for him as the Buchwald procedure, can reduce heart disease and save lives. One of Dr. Buchwald's recent initiatives involved recruiting former NFL players to become role models for weight loss and healthy living. He also collaborated with fellow Columbia University alumnus Archie Roberts, a former Miami Dolphin and cardiac surgeon, which led to the creation of the Living Heart Foundation's Heart Obesity Prevention Education Program. They are now involved in testing metabolic surgery for traumatic brain injury. Dr. Buchwald continues to contribute to the medical field and advocate on behalf of patients. Last year, his book, Healthcare Upside Down, was released. In the book, Dr. Buchwald thoughtfully considers the ways in which we can turn the current healthcare system right side up to serve those who should be the ultimate beneficiaries, all of us as patients now and in the future. Dr. Buchwald, it is my honor to have you join me on stage to present this honor.
Good evening. This is a great honor. And I'll quote author Pearl Buck. To find joy in work is to discover the fountain of youth. And in that spirit, I would like to thank the Alliance for Aging Research for honoring my work, for which I've taken great joy in performing. As I entered my 90s, and I'm in my 90s, I formed 3 precepts. The first was accept indignation with tolerance, forbearance. We had a plumber in the house, and he was explaining to me what he did, and I also have to wear hearing aids. I didn't quite understand. I kept asking him to repeat himself, and finally he looked at me and he said, I'll go talk to your wife. When I went to a restaurant with my father when he was in his 90s, they would look at him and then turn to me and said, what is he going to eat? Well, today I go to a restaurant with my children or my grandchildren, and they look at me and they turn to my children or grandchildren and said, what is he going to eat? And you have to tolerate this with forbearance. It comes as a gift of age. Now, you also have to accommodate. I had the privilege of having an athletic youth. I ran marathons. I ran the Boston Marathon. And I can't run a marathon anymore. But I still run a mile a day, and I still swim. So my message would be to accommodate. And you have more time when you get older. In surgery, we had a word, scut work. We had to do a lot of scut work, things we really didn't want to do. Putting in catheters and things. We don't do that anymore. You're free. And therefore, you can increase your horizons. You can do new things and interesting things. So those are things of acceptance. But never accept ageism. Don't accept mandatory retirement. I was afforded the privilege of still being an active surgeon when I was 84. Don't accept because you're a certain age you gotta go retire. Now, In the past, the NIH rarely, if ever, gave a grant to anybody over 65. I have a graph that shows this. Grants, 65, no grants. That has changed, and for the NIH, should be credited. And finally, don't give up work. If you enjoy what you're doing, keep doing it. I had the privilege this afternoon of meeting with the executive director of NFLPA. I work for the NFLPA, well, I consult for them, and we're trying to do something about traumatic brain injury, which actually affects about 12% of Americans, but has been popularized, so to speak, by the football players who are dying at a young age by the progression of this terrible disease to CTE, or chronic traumatic encephalopathy. And I've just published a book recently called Healthcare Upside Down. And it refers, the congressman must have read my book. It refers to what's happening in medicine today. We have in the criteria, international criteria, we are very low. We're lower than every European Western nation, New Zealand, Australia, and Canada, in life expectancy, fetal mortality, and so on. We are number one, though, in cost. And if this is going to be a business model, how can a business succeed if it charges more for less? That's not in the capitalistic spirit. So I like to thank everyone in this room, because if healthcare is upside down, you are working to set it right side up. And thank you. I'd like to finish my remarks with a Hasidic proverb. For the unlearned, old age is winter. For the learned, it is the season of the harvest. And thank you.
Those are great words for us to think about. It is now time to have our dinner. You will see that this is an incredibly special dinner. We want you to sit back, enjoy it. We're going to have a photographer go around and take some pictures. A hint for those, if you want to look good, put your hand on your hip and chin out. But anyhow, have a great dinner, and we'll be back to you in about 10 or 15 minutes. Enjoy.
Good evening, everybody. I'd like to call the meeting back to order. As Kevin Rigby would say, shh. Thank you. So, my name's Jim Scott. I'm privileged to be the chair of the board of the Alliance for Aging Research for 6 years now. I will be pleased to hand the gavel over tomorrow to Michelle Marcus, who I'm grateful for her support as vice chair. I really loved Sue's reference to Don Quixote because it calls on all of us to be heroes and have the courage to carry on the fight to reach the unreachable star. And nobody's been a better example of that, having that courage, than Sue Peshin. So thank you, Sue. On behalf of the board, it's my pleasure to be with you this evening. The tenacity, vision, and sheer courage of this year's award recipients are inspirations in every facet of our work. How about Dr. Buchwald? We are honored to consider them partners in helping people live longer, happier, and more productive lives. And please join me in congratulating all our awardees this evening. Thank you also to my colleagues on the Alliance's Board of Directors. Each board member has made significant contributions to helping the Alliance with its mission. They are equally invested in making sure older Americans receive access to the care and treatments necessary to live long-lasting, healthy, and rewarding lives. The generous corporate organization and individual contributions received at our Heroes in Health celebrations allow Sue and her team to be out front on Medicare affordability issues and coverage for FDA-approved treatments, bring awareness to heart valve disease and neuropsychiatric symptoms of dementia, advocate for older adults to receive their CDC-recommended vaccines and COVID boosters, help older adults become engaged in research and advocacy through the Talk Nerdy program, and activate the many initiatives that the Alliance works on throughout the year. Your being with us tonight inspires us to keep moving forward every day to ensure that the experience of healthy aging in this country is one of progress, dignity, and kindness. We hope our work inspires you to connect with us at an individual level of support. All contributions received tonight are fully tax deductible and will further the Alliance's mission. Please make your personal contribution this evening by turning to the iPads where you answered those questions for Kevin on the table and clicking the Donate Now button at the bottom of the screen. There you will see a QR code. You can scan the QR code with your camera and then app on your phone and then point and then, oh shoot, they gave me instructions for Android users. Well, if you're an Android user, you will see a pop-up. For iPhone users, you should see the URL link appear. Tap either the banner or the link, and you will be redirected to the Alliance's secure donation page. But perhaps an easier way to do it would be to visit the Alliance staff at table 32. Table 32, where are you? There you are, and they can help you make a donation. So thank you all. Congratulations again to the honorees and to Sue and the entire Alliance for such an extraordinary event. And now I will hand it back over to Kevin, watch your step, to introduce our next award.
All right, thank you. So I had the pleasure of serving on the board, and not only serving on the board, but serving with this gentleman. And Jim was an outstanding board member, and he missed the meeting, and we made him the chairman. 6 years later, after great leadership, he has really taken with Sue collaboratively to make the Alliance the incredible entity it is today, with a profound effect influencing legislation, influencing where things are occurring, and that's not easy. So again, Jim, as your final night as chairman, a big round of applause for Jim Scott. And I know we're a bunch of A personalities, so we're at the third question with regard to Here It Comes. Are you ready? And by the way, I do appreciate the money I was handed as I was going around. I cannot be influenced. I am from New Jersey, but I do know that I can accept stuff. Are you ready? Here it comes. Which of the following news outlets did the Alliance work appear in this year? A, Time, B, Forbes, C, Wall Street Journal, D, Washington Post, or E, all the above? You have 30 seconds. Everybody has to vote. Okay. 5, 4, 3, 2. The vote is in. Okay, thank you. All right, we got one more to go. It's going to be interesting to see who wins it. But our next presenter this evening is the Alliance's good friend, my personal good friend, is Tom Spulek. He's chairman and president of the Claude Pepper Foundation, and he's here to present the Claude Pepper Award for Advancing Healthy Aging. Tom will tell us more about this important award. It's named for the Honorable Claude Pepper, who fought tirelessly in the U.S. Senate and in Congress to help those in need, including our nation's older adults. In his day job, Tom is partner in the law firm of King & Spalding, and he chairs its Government Advocacy and Public Policy Group in Washington, D.C. Tom also serves as an adjunct professor at Florida State University before he entered private practice. He's also served as staff director, and in fact, he was general counsel of the House Committee on Rules, as well as general counsel for the U.S. House of Representatives. I also know that Tom devotes a lot of his personal time doing nonprofit work. So let's bring Tom up here and talk about this award. He really deserves it. Bring it up here, Tom.
Thank you, Kevin. You do a phenomenal job every year of leading this dinner. It just gets better and better, and so thank you for that. I also want to thank Sue, Sarah, and the entire Alliance team for putting on another spectacular dinner again this year. And finally, a huge debt of gratitude is owed to Dan Perry for his courage, his vision, and his dedicated efforts over the years to help make the Alliance what it is, and for joining with the Pepper Foundation some years ago to create the Claude Pepper Award. And on that subject, it's my distinct pleasure to introduce the recipient of this year's Claude Pepper Award for Advancing Healthy Aging. The award was established to honor a Democratic member of Congress who is leading the way for policies encouraging medical research, innovation, and care to benefit Americans as they grow older. Former recipients have included Nancy Pelosi, Harry Reid, Dick Durbin, Frank Pallone, Tom Carper, and others. And tonight's recipient, Representative Anna Eshoo, fits squarely in the mold of those influential and important members of Congress. Supported by the Claude Pepper Foundation, this award is named for the Honorable Claude Pepper, who some of you may remember. He passed away in 1989 as a congressman from Florida. He fought tirelessly in both the Senate and the House of Representatives to help those in need. As chair of the House Select Committee on Aging, he sought to strengthen programs for older Americans and disabled Americans, including Social Security, Medicare, and Medicaid. Through the Claude Pepper Foundation, the Claude Pepper Center, the Congressman's legacy lives on at Florida State University and is dedicated to research on aging, alternatives to long-term care, and other issues. I'm proud to introduce, if you'll allow me, the recently appointed director of the Claude Pepper Center, Dr. Dawn Carr. Dr. Carr is a gerontologist and a professor in FSU's Department of Sociology under the leadership of Dean Tim Chapin. And finally, if you'll allow me to introduce two other members of the Claude Pepper Foundation board who are with us tonight, George Crawford, my dear friend, who also worked for Senator Pepper and was later Chief of Staff to Nancy Pelosi, and Florida Senator Loran Osley, and colleagues of mine from King and Spalding, David Farber, Priya Pinto, and Jonathan Trent. Thanks for being here. Now, it is with great honor and admiration that we gather here tonight to recognize a remarkable advocate for older adults, Congresswoman Anna Eshoo. In a world where the needs of our aging population are often overlooked, she has stood as a tireless champion, unwavering in her dedication to improving the lives of older Americans. And have a little surprise maybe. In fact, Claude Pepper thought that because when she ran for the first time, he made a little commercial for her. And thanks to this great collection that we have down at Florida State, we have this footage. So I think it's going to be run.
Anna, I'm looking forward to seeing you come to the House of Representatives and working with you. You're the kind of champion of the elderly, fighter for good causes, women's rights, and the other thing that we need in the House. I'm looking forward to working with you.
Well, you've been a role model for me, whether you realize it or not. And all of the legislative efforts over the last 6 years, since I've been on the Board of Supervisors and now looking to go on into the Congress and join you, it's been legislation that's been modeled after what you've been doing.
Well,
but we need to do more.
Well, Anna, thank you very much. I'm delighted to hear you say that. And I knew already what your record was. I knew you'd be a great addition to the House.
Thank you very, very much.
Representative Eshoo's commitment to health care started early in her public service career. As president of the San Mateo County Board of Supervisors, she crafted the health plan of San Mateo County, one of the oldest county organized health systems in the nation. But once in the House, her passion for expanding and improving health care grew exponentially. In fact, it is difficult to overstate Congresswoman Eshoo's accomplishments since arriving in Congress. She was the first woman in the history of Congress to chair the House Health Subcommittee and has been at the center of championing legislation to increase funding for biomedical research at the National Institutes for Health and creating the Advanced Research Project Agency for Health, known as ARPA-H. Her work was also critical in advancing patient affordability and access provisions in the two most significant pieces of healthcare legislation in the last 15 years, the Affordable Care Act and the Inflation Reduction Act. She consistently fights on the side of patients having access to care that they need. And just this year, we've witnessed the Congresswoman's courage in demanding that Medicare provide meaningful access to disease-modifying therapies for people living with Alzheimer's disease. But it's not just the policy she advocates for, it's the genuine care she demonstrates for the people she serves. The Congresswoman has always been willing to listen, learn, and act on behalf of those whom she represents. She has shown us that leadership is not just about making decisions, but about understanding the impact that those decisions have on real lives. Congresswoman Eshoo, your tireless advocacy, your unwavering compassion, and your enduring dedication to the well-being of older adults inspires us all. And so it is with great pride and immense gratitude that we present to you the Claude Pepper Award for advancing healthy aging. Thank you for your extraordinary record and service.
Oh my goodness. Isn't it wonderful that all these things are kept and we don't know that they are? Really. Tom, thank you for that really beautiful and kind introduction. And good evening, everyone. It's wonderful to be with you. And we did have a vote series. I was so worried that I wasn't going to make it, but it's all worked out. We're going to go back later on tonight, too. Yes, yeah. I just wish this whole thing would go away, don't you? Just go away. Just go away. Just go away. After all, it's about this magnificent country of ours. I don't like to see anything that brings a sense of disgrace to it. The people have given their lives for this great country, and we can never, ever forget that. I think sometimes it's forgotten. So I want to thank Sue Peshin, the president of the Alliance, for your superb leadership. Tom, thank you for yours. Thank you for yours. And to have been the lawyer for the House of Representatives. I don't know, were you listening carefully when he was being introduced? These are key, magnificent, extraordinarily important roles that really play a key role in our democracy. So thank you, thank you, thank you, thank you. I also want to congratulate Congressman Brad Wenstrup because he's receiving the Distinguished Public Service Award. And, you know, these issues are not partisan issues at all, at all. And so I so welcome his leadership. He's been a great partner, and I look forward to partnering with him, continue to partner with him. So bravo and congratulations, Brad. This award means a great deal to me. I remember watching TV and listening to Claude Pepper giving his speeches. You know, that was a time when the Congress really had good things going, and they carried these speeches. And first of all, I thought he was adorable. There was just something about him, you know, and then I got to meet him, and you saw that. Boy, that's from my distant past. That was 1988 when I ran for Congress and didn't make it, But he was unrelenting. I mean, from the depths of his soul, with every ounce of everything that he was, he gave to advocating for older Americans, what their needs would be. He anticipated what their needs would be too, and he was never satisfied. He was grateful when there was a victory, but he didn't stop very long to celebrate because he knew there was so much more to do. So for you to give me an award with his name on it means a great, great deal to me. I can't wait to tell my children. And I know my mother and father are watching from heaven. Let me just tell you just a brief story when I say my mother and father are in heaven. When my mother's health was waning, I stayed home with her. I had moved my parents to my home. Daddy had gone to heaven, and then Mom's health, as I said, was going downhill. And she said, "You can't do that. You can't stay home." I said, "Why? Why can't I stay home? I think my constituents are going to understand this and say, 'Bravo, Anna.'" And she said, you're going to miss the Social Security vote. So, yeah. So, I mean, that was, ingrained in them, that a gift of the nation, saying, you count, you have dignity, we stand with you. And that's what Claude Pepper represented. And, it was really quite remarkable. He was elected to the Senate. He served 3 terms there, and then he came to the House of Representatives for another 36 years, over 50 years of magnificent service in the Congress. It's a good thing they didn't have an age limit. Now they want to throw people over the, over the side. Age doesn't matter if your mind is working, for heaven's sakes. But at any rate, what a role model. And he championed the National Institute on Aging, which today we still rely on for a better understanding of aging. And the better we understand, the more precise we can be about not only the resources, but to tailor those policies so that they have precision to them as well. Every day, and you know this, every day 10,000 Americans age into Medicare. Every day. Every day. That's a jaw dropper. So we have the responsibility to ensure that older adults have the care, they have the support, and the resources that are absolutely necessary to bring all of that to them. I think, much like Senator Pepper would ask himself, what have I done today? What have I done today to lighten the burden of those who suffer? And there is suffering in the country because the families attached to older Americans walk that path with them. I know because I did with my mother and father. And I have no regrets. That's the beautiful part of it. And it's not just a responsibility, it's about love and respect as well. And, as I talk about my own family, families across the country and patients deserve the access to life-changing treatments. And that's why when the whole issue of the new drug that was being approved by the FDA, for early on, diagnosed dementia, every minute counts. Every minute. Every minute. I have to tell you, I thought, how dare anyone in any agency in our government even take a pause as to whether that was going to be paid for or that it would just be some. How do you divide? That's like, saying, who's your favorite child? I mean, it's not part of our collective conscience. And we are a rich nation, despite what you hear from some. We are not broke. We're a great nation, a nation that I believe still has and always will have a conscience. So these are fights that are so important to wage. It's so important to wage. And that our children know that we are waging them. Our grandchildren maybe someday will know that we waged them, and that they will replicate that in some way, shape, or form when they're grown. Because they stand on our shoulders. I always remember Hubert Humphrey saying that a nation is measured by who and how it cares for those in the spring of their lives and those in the autumn of their lives. So I want to thank you, all of you, the magnificent advocates, all of the organizing. So many of you have done this for a lifetime. And I think that you are a great, great blessing to our country. I think you're national treasures because as one member of Congress, that's only one person, you know, and that you walk the halls of the Congress, you call, you write, all that you have done, decades and decades and decades, to make sure that we can together get these policies over the finish line. I can't be without you. I really cannot be without you. And I think that's the case for every member of Congress. I'm not unique. So I'm here thanking you. This is a great honor. Those that have been given this award, it's quite a club to be joining, and especially with now the Speaker Emerita, Nancy Pelosi. Our country has been blessed by her leadership. So, my friends, thank you. I say it from the bottom of my heart. I love you all. Don't ever get tired. Don't ever get tired. We need each other. Thank you, everyone. Thank you. God bless you all. Thank you.
What an inspirational talk, and thank you, Congressman Eshoo. That was a great comments for us to hear after dinner. Of course, I've got to follow that incredible comments by giving more trivia quiz. Anyhow, get ready, because this is the next trivia quiz in the back. Okay. The Alliance has collected some new hardware this year in the form of golden tellies. So what are golden tellies? Telly Awards honor the best in TV and cable, digital and streaming, and non-broadcast productions. How many tellies has the Alliance won? A, 8, B, 12, C, 16, D, gazillions. I think Scrabble will challenge gazillions. You now have 30 seconds. Come on now, 30 seconds. This is the last one. Five, 4, 3, 2, 1. The votes are in. So that wraps up our trivia game. So in a little while, in the next few minutes after our next speaker, the winners will be announced. So while we're waiting for that, it's my pleasure to announce our next speaker, which is Andrea Michelli, to the stage. Andrea leads the global policy team of policy experts across all of Johnson & Johnson as the Vice President of Global Policy. Of her many responsibilities, if you read that, you understand we're talking about global policies for Johnson & Johnson. Her bio is quite impressive. She's also a proud member and an active participant of the Alliance of Board of Directors. Johnson & Johnson really should be thanked and acknowledged for supporting this year's Perennial Hero Award. Please join me in welcoming Andrea to the stage. Did I make it the right one? Only policy to know that.
Ready to go. Ready to go. Thanks
so much, Kevin. Good evening, everyone. I am so honored to be here tonight to help present this year's Perennial Hero Award to Edwin Walker. Edwin Walker serves as the Deputy Assistant Secretary for Aging of the Administration on Aging within the Administration on Community Living. In this very important role, Deputy Assistant Secretary Walker guides and promotes the development of home, community-based, long-term care programs, policies, and services designed to afford older people and their caregivers the ability to age with dignity and independence. And really, isn't that what we're all here about tonight, right? His work includes the promotion and implementation of evidence-based prevention interventions that have been proven effective in both avoiding and delaying the onset of chronic diseases and illnesses. A kind and brilliant advocate for older people, Deputy Assistant Secretary Walker has served as the primary liaison with Congress on legislation that's designed to help aging services and programs. For more than 30 years, close to 40 years, across several administrations, he's been characterized as a consummate professional civil servant who can be relied upon to represent the best interests of our nation's senior citizens. Additionally, Deputy Assistant Secretary Walker has created and given oversight to programs such as our nation's more than 600 area agencies on aging, the Long-Term Care Ombudsman Program, the National Family Caregiver Support Program, and the Lifespan Respite Care Program, all of which have provided invaluable support and flexibility at the local level to older adults and to family caregivers. Deputy Assistant Secretary Walker. It's an honor and a privilege to be with you tonight to celebrate your inspiring career and to present you with the 2023 Perennial Hero Award. Please join me on stage.
Good evening. Kevin, we have a falls prevention program as well. But thank you, Andrea, and Johnson & Johnson for underwriting this distinguished award. I was truly wowed by this. Thank you, Sue. I saw her somewhere. Sue, and the staff, and I have to say for years I've worked with Sue and collaborated with Dan before Sue and Jim and the board. I just thank you all for first considering me and then honoring me with this incredible recognition. Thank you to each of you in this room for all that you do each and every day, but I also have to say thank you to our fellow honorees, and because they are incredible. Dr. Buchwald is truly the example of healthy aging, which we all talk about, but thank you for what you all do in terms of aging research, in terms of health, and improving the lives of people here in the U.S. and actually throughout the world. I have truly been blessed, and I'm honored to have had a career in the field of aging, especially since it was not my plan, but it truly has become my passion. My journey has been quite interesting because I always say I fell into the field of aging, and then I fell in love with it. Right out of law school, I needed health insurance more than I needed anything else in the world. My then wife was chronically ill with rheumatoid arthritis and had had her first total hip replacement at age 26. Upon graduation, I really didn't think that a young black attorney in mid-Missouri would have a successful practice, and, or at least not successful enough to make a living and to pay the cost of health care. So I sought out state government to get a good group health plan, and I applied for anything and everything that I was remotely qualified for. And it just so happened that the Division of Aging was my first interview. And it was for not an attorney position, but an entry-level position as a monitor of AAAs, for which at that time my frame of reference was the Automobile Association, right? But I recall vividly leaving the interview and thinking, that would be the last thing in the world I'd ever want to do. But before I withdrew from consideration, I was called with a job offer. And while stalling on the phone with the HR director to inquire whether or not there was another position that I could possibly get, my wife, who's on her sickbed, says, "Take the job, you fool. It's a day job with benefits. You're not going to be there 2 weeks." And 40 years later, I remain grateful for that not-so-gentle push. I credit my longevity in this area to how the mission of our work resonates with my own personal beliefs and values. I've worked in a field where we are focused on advocating and on helping older individuals maintain their health, their dignity, and their independence, and we assist them to live in their own homes and communities and to be fully engaged as members of the community. We achieve this by being truly in touch with them, by focusing on person-centered care and providing supports that are valuable to them and to the family, friends, and neighbors who provide care to them. And I've been blessed to have an incredible string of opportunities to impact public policy, to improve the health and the well-being of older adults and young adults who are preparing for their longevity. I've had the pleasure of working collaboratively with the science and research worlds to identify needs and to identify gaps, to test and implement innovations, to scale results to the nation, to train, educate, disseminate proven practices, and to truly realize the value and the real-life benefits of research. I've had the opportunity, and I would say the honor, to better integrate health and social services to improve people's health, their functioning, and their quality of life, to highlight the value of the social determinants of health, and to demonstrate how to work together with healthcare so that we can achieve greater outcomes in terms of good health outcomes. And most recently, I've had the pleasure of developing national vaccine access strategies to find and to convince the hardest to reach in our populations, those who are hesitant, those who are uninformed, and those who historically have not had access to or are unable to have access to health care. I've been privileged to coordinate with NIH and in particular NIA. And we've done that to complement one another in terms of a care and cure strategy. We provide care and support to people experiencing illness and chronic illnesses and conditions while they focus on cures and mitigating the effects of illness. I've been in positions that enabled me to promote or to be a promoter of health and healthy lifestyles, advancing and disseminating a broad array of evidence-based health promotion and disease prevention interventions that have been proven through research to produce better health outcomes and to even save healthcare expenditures. I've been honored to collaborate with the Office of the Assistant Secretary for Health and the CDC on developing strategies to implement the state of the science related to healthy aging in states and communities all across this nation, and to work globally with the United Nations and the World Health Organization in terms of advancing healthy aging and age-friendly communities, all the while combating ageism and considering approaches to reframe aging and to bring about societal changes so that aging is viewed positively, so that it's embraced, and so that it's respected and honored. And for the future, we all need to continue investing in the next generation of leaders in the field of aging, to position them, to inspire them, to instill in them the principles and values that truly endure and that will serve our nation very well, restoring integrity, restoring collaboration and collegiality, and yes, even restoring civility. So thank you once again. But before I take my seat, I have one request of the Alliance and of each of you. And that is, and I want you to remember the spirit of Claude Pepper, to keep pushing, to keep accelerating, to keep taking risks, keep changing and the conversation and challenging us, the institutions, the political leaders, and the policymakers. I saw something on your website that I absolutely loved, which said, living longer and loving it. Let's all advance that concept. Thank you once again.
Well, we're so glad you had a smart wife that kept you in this profession. What a great speech and comments and inspirational things for all of us. So I am now pleased to share with everybody the trivia game is closed. We have a winner. The winner is table 23. All right, so please go to the tech table in the back room before the end of the evening to retrieve. All of you will receive a prize. We hope that that was a little bit of fun on the 30th anniversary. We thought you would enjoy that. Congratulations to all of you for participating. We're now here to present the final award, the 2023 Daniel Perry Founders Award. He's a dear friend, obviously, of the Alliance. But we really want to talk about who's presenting this evening. The supporter this time, the advocate who's going to present it, is Dorothy Ochita. Now, Dorothy. Now, Dan Perry, who is here for every year and is the founder, is not able to be with us, but he is totally fine. He's still in Maine. He's watching us now. So if you'd all turn to the camera behind us and all give him a big wave. Hello, Dan. We miss you, but hope to see you next year. Now let's talk about Dorothy, who's really incredible. Over 40 years of extensive experience in patient advocacy and alliance at a global, national, and state level. Currently, Dorothy serves as chair of the Board of Trustees for the ASCP Foundation. So let's bring Dorothy up here to bring the last awardee for this evening.
Thank you, Kevin, for making sure that I get up here safely. But thank you, Kevin, and I'm delighted to be here with all of you to present the 2023 Daniel Perry Founders Award to Chad Wartz. A board-certified geriatric pharmacist and chief executive of the American Society of Consultant Pharmacists, also known as ASCAP. How many of you know what ASCAP is? Raise your hand. For those of you that don't, you should. They are a membership organization that represents pharmacists, healthcare professionals, and students serving the very unique medication needs of older adults in long-term care in our community. We all know so many of those members. But from day one of the pandemic through the current transition today, Chad has exemplified to us what it is to be a national leader in public health during a crisis. Being a leader is one thing. Being a leader in public health is another thing. But being a leader in public health during the crisis of the COVID pandemic is something all into its own, we'll all admit. In late March of 2020, through the request of the Alliance, Chad developed a webinar to educate thousands of area agencies on aging, AAAs, workers and volunteers about the safe medication handling practices for older adults in the community. When no one knew at that time, we were all so scared and fearful what information, who to turn to, and who to trust. Chad marshaled ASCAP consultant pharmacist members from across the country as essential frontline workers who continue to ensure that millions of older adults residing in long-term care, subacute care, psych hospitals, hospice programs, at home and in our communities, receive the medications that they depended on from professionals that they knew, but most importantly, that they trusted. At that time, many of us did not know who to trust, who to believe, where to go, who to listen to, who really knew the science of the time. Chad became one of a very small group of people in daily contact with HHS, Administration on Strategic Preparedness and Response, ASPR, as we all know, as well as CDC leaders to help coordinate, problem solve, and broaden the federal retail pharmacy program. ASCAP's efforts also helped allow pharmacists to administer over 300 doses of COVID-19 vaccine. Chad also advocated for FDA to make the needed changes in language for the emergency use authorizations for antiviral medications, so that pharmacists could directly order those meds in settings when a physician was not readily available. Hard to believe, but the pharmacists had to step in and fill that really important role in a crisis. ASCAP is currently working with NCOA and the U.S. Boxing Association to hold COVID-19 and flu vaccine events across the country in the fall. If all of that, now remember, that was a short period of time from 2020 to now. If all of that weren't enough, Chad and ASCAP served as co-conveners with the Alliance on the Project Pause Coalition. So what is the Project Pause Coalition? The coalition is an in-the-trenches long-term care providers, health equity, and family caregiver groups. Many of the leaders are in the room today. It was great to see you again. To ensure that long-term care residents living with neuropsychiatric symptoms of dementia and other serious mental illness receive the high-quality, patient-centered care, appropriate care, without facing stigma or barriers. Chad, tonight we celebrate you and your extraordinary and exceptional ASCAP team with the 2023 Daniel Perry Founders Award. Please come up.
Thank you, Dorothy, for that introduction. First of all, thank you to the Alliance for Aging Research, the board, the awards committee, the sponsors, the other awardees who I don't feel like I belong up here with, and all of your incredible teams for recognizing the important work of ASCP, or ASCAP, and its members. I came to ASCP 5 years ago, a practicing pharmacist and member of the organization, a business person who had just moved his family from the Midwest with really no idea how I was going to get started in this job. I was asked to speak in Florida at the Florida Medical Directors Meeting. I'm certain, probably because of my new title, more than anything anyone really knew about me at the time. I had a tight schedule, and as I was finishing on stage, I had to beeline for an Uber to get back to the airport. But I can still visualize, either over here or over here, I think it was over here, this rapidly moving person in the round auditorium racing around the perimeter to intercept me at the door. She mentioned a dinner in DC with all the important people and that I should attend. Some of you may know that was Dorothy. I did attend, and I did meet so many wonderful people, many in the room tonight. At the dinner, we went around and introduced ourselves. It was amazing. And I felt like I was seeing people in groups that I knew ASCP needed to work with. And I think they felt the same about ASCP. I remember hearing from Dorothy about Sue. She was tough, a force, making me a bit intimidated to meet her. But we did meet, and the rest is history. In fact, if you've ever been on a phone call with an editor of a newspaper that was going to write a story that you didn't really like and sue, you would know that toughness and courage that I'm talking about. Or if you're a certain worker at one of the agencies that is against us in any of our efforts. I'm so incredibly grateful for Dorothy. She is the chair of our foundation today, and I'm incredibly grateful for Sue, who we have stood beside in many, many battles to improve the care of older adults. And also all of you, many of you that we work with and others in the room that we need to work with. I am lucky. ASCP is forever grateful. I'm very honored to be mentioned alongside Daniel Perry, the founder for the Alliance for Aging Research. Dan. Daniel started the Alliance in 1986, and if you Google him, which you should, you'll find his podcasts, blogs, TED Talks, and the important work of the Alliance for Aging Research. They are provocative, courageous, but maybe what resonates with me the most is they're small. They're a band, as I like to say. One that, in Daniel's words, says punches above their weight. ASCP is a lot like that, and the work of our pharmacies and pharmacists also represents what once was a small sector of healthcare, a niche market of professionals working in nursing homes and assisted living centers, and now we've become an expertise, a group of thought leaders focused on medication management and the aging health of a nation. The number of people 65 years and older moves from 57 million to 74 million in the next 6 years. A profound shift that requires all of our attention if we aim to improve the quality of life and care for this critical and adored group of people. I took the liberty of adopting a poem by Paul Harvey, whom many of you may know from radio. In Cincinnati, as I went to school, as I did my work in the hospital, as I started my journey as a pharmacist, I would get up early and his radio show would always be on in the morning. The rest of the story was a mainstay for me when I got up that early. He penned a wonderful homage to the American farmer called So God Made a Farmer. It was featured in a Super Bowl commercial in 2016. Our work at ASCP is about pharmacists and the role they play in medication management. I came to DC understanding that for us to succeed as a people, we needed to care for our aging neighbors better. We needed to be prepared and position services to meet them where they are. The intersection of older adults and medication use is nearly gridlocked today, but pharmacists stand ready to be a solution. It's my pleasure and life's work to ensure that pharmacy services are accessible, available, and of the highest quality. So my adaptation of Paul Harvey's poem. And on the 8th day, God looked down on creation and said, I need somebody to tend the health and well-being of my children. So God made a pharmacist. God said, I need someone detail-oriented, with a keen eye, someone who can meticulously order treatments and measure doses, give vaccinations, someone who can dispense healing and hope. So God made a pharmacist. God said, I need someone who can decipher the doctor's handwriting, translate it into a prescription that saves lives, who can counsel and comfort, problem solve, and bridge complex concepts into everyday terms, someone who can be a trusted advisor in times of sickness. So God made a pharmacist. God said, I need someone who can work late nights and early mornings, stay open during a pandemic, stand behind the counter with a smile, knowing that their work is essential to their health and community. So God made a pharmacist. God said, I need someone who can keep up with the ever-changing world of medicine, someone who can stay informed and adapt to new treatments and technologies, someone who can fight for and against medication use, someone who can advocate for others. So God made a pharmacist. God said, I need someone who can be patient and compassionate, someone who can listen and understand, someone who can offer a word of encouragement when it's needed most. So God made a pharmacist. God said, I need someone who can be a pillar of the community, someone who can be trusted with the most intimate details of a person's health, recommend what is best for them regardless of challenge, and someone who can provide a sense of security and peace of mind, alleviating the fear of the unknown. So God made a pharmacist. Thank you on behalf of the 5,000 pharmacists and pharmacies of ASCP and the 24 hardest working people in the association business. Some of them are here tonight, Jim, Arnie, Avra. Thank you to my children who moved from Cincinnati to Alexandria 5 years ago so their father could tilt at windmills. And thank you to my wife, Sarah, who manages the chaos of the 3 teen and preteen children. Thank God he made you. She's also a pharmacist. Thank you.
Well, let's thank God for pharmacists. And let's give a big round of applause for all the recipients tonight. So as you can imagine, a dinner of this size and all the accomplishments we saw in the sizzle reel, it all takes a team of the Alliance for Aging Research to put this together year in, year out for passion and results. So let's have the Alliance team stand up one more time to get applause. Everybody up, up, up. And let's let it rip for the leader, Sue Peshin. So now, before we close out the program, we have some results we want to also share with you. Tonight raised the most money we've ever raised for the Alliance for Aging Research, $642,625. Wow! You know, each year I get a call and Susan said, I think we want you back up here. I said, really? I will tell you this, it has been a joy to be on the board. It's been a joy to be a part of it and to play one itty-bitty part to be driving this forward. And to think you're on the stage with, these are heroes. Each one of these people you heard motivated me. One was better than the next, and it happens each and every year. But really, the stars are sitting in those seats, you. You're making the difference. You can't do it alone. We can't do it with the Alliance. The Alliance knows it is collaboration is the key. And the collaboration begins with all of you collectively working toward this goal. So I know Sue has asked me to say a huge thank you. It is not just the money. It's what you do in your companies, what you do in your personal time. You won't let it go. Never let it go, because people in need you to continue to move forward. So on behalf of everybody, we want to thank you for a wonderful evening. We committed to say 9:30 would be it. Tonight, we also have incredible desserts for you. Please have some of them. If you can't, we've got boxes to take them home. Welcome here. I hope you had a wonderful evening. On behalf of the Alliance, congratulations and thank you.